Hello and welcome to the Young Orthopod. This is the first video in our Osteology series, and today we'll learn about the clavicle, its parts, muscle and ligament attachments, the fracture classification, and a few key points about the bone. The clavicle is the first bone to ossify, and its sternal end is the last ossification center to fuse in the body. The clavicle functions as a strut, bracing the shoulder from the trunk and allowing the shoulder to function at optimal strength. The clavicle is a S-shaped cylindrical bone that lies horizontally in the body. It has an anterior border and a posterior border, the rounded medial sternal end and the flattened lateral acromial end, and two surfaces, superior and inferior surface. The superior surface is smooth and subcutaneous, and the inferior surface is rough and have the subclavian groove. Medial 2/3 of the bone is circular in section and convex anteriorly and has an anterior and posterior surface instead of borders. The lateral 1/3 is flattened in section and convex posteriorly. So this is a right-sided clavicle. Medially, it articulates with the manubrium at the sternoclavicular joint and to the first costal cartilage by the costoclavicular ligament. Laterally, it articulates with the acromion at the acromioclavicular joint and to the coracoid process by the coracoclavicular ligament. Anterior surface of the medial 1/3 gives origin to the clavicular head of the pectoralis major muscle. Posterior to that, there is origin of sternocleidomastoid muscle. The lateral 1/3 of the anterior border gives origin to the anterior fibers of the deltoid muscle. The lateral 1/3 of the posterior border provides insertion to the trapezius muscle. If you look at the inferior surface, the costoclavicular ligament is attached to an oval impression at the medial end of the inferior surface. The posterior surface of the medial 1/3 gives origin to the sternohyoid muscle near its medial end. Subclavius muscle is inserted into the subclavian groove on this surface. Lateral third of the inferior surface presents a conoid tubercle and a trapezoid ridge, which provides attachment to the conoid and trapezoid parts of the coracoclavicular ligaments respectively. Clavicle is the most common fractured bone, and mechanism of the injury is fall on the shoulder or an outstretched hand. The weakest point is the junction of medial 2/3 and the lateral 1/3. The clavicle fractures are classified by the location of fracture in the proximal, middle or distal third of the bone according to the Allman classification. Group 1 includes fracture of the middle third. 80% of the clavicle fractures occur in the middle third, and most of these are amenable to close management. Group 2 includes fracture of the distal third. This is subclassified according to the location of the coracoclavicular ligaments relative to the fracture. The type 1 includes minimal displacement fractures with ligaments intact. The interligamentous fracture between the conoid and trapezoid or between the coracoclavicular and acromioclavicular ligaments. Type 2 includes displaced fractures with the fracture line medial to the coracoclavicular ligaments. These has a higher incidence of the non-union and are further classified into type 2A and 2B. In 2A fractures, the conoid and the trapezoid ligaments are attached to the distal segment. In type 2B fractures, the conoid ligament is torn, but the trapezoid ligament is attached to the distal segment. The type 3 includes fracture of the articular surface of the acromioclavicular joint with no ligamentous injury. And finally, the group 3 includes fracture of the proximal third of the clavicle. These are usually minimally displaced if the costoclavicular ligaments remain intact. Group 3 is again subclassified into types 1 to 5. So this was all about the osteology of the clavicle, and this is the minimum that one must know before facing the Vivas. We'll be back with more videos in the osteology series soon. If you like this video, then please like and subscribe to our channel on YouTube. And for more topics and daily quiz on orthopedics, please follow and like our page on Facebook, The Young Orthopod, and subscribe to our blog, The Young Orthopod on Blogger. Links are in the description. See you soon.